and welcome to another edition of Health Solutions with Sean and Janet Needham, where Team Needham discusses everything healthcare. I'm your host, Sean Needham, along with my wonderful wife, Janet, and we are streaming live from Boise, actually Meridian, Idaho, and we are so happy to be in Idaho. We just love hanging out with friends. We met so many cool people here over the last few years, and we enjoy being in Idaho. So welcome to our podcast again, and today we're going to be discussing AI in healthcare. So without further ado, RJ, welcome to our show.
Thank you. Thank you for having me.
So go ahead and introduce yourself a little bit and tell us your history.
Yeah, my name is RJ Kedziora, co-founder of a company called Estenda Solutions. Started way back in 2003, so crazy when I can talk about decades now. But going back a little bit before that, I got my start in computer science undergraduate and had the idea of getting a PhD in AI back in the early 90s. It's one of those interesting things that people don't really realize. AI has been around for a long time. It just didn't pop up on the scene. But I got a job offer in the early 90s and said, take on more debt or go out in the world and make a living. And I did decide to go out and make a living in software development, but always played with AI. I was always fascinated by the different iterations of AI over the years. And now, as we all know, in 2022, Gen AI sort of hit the scene with a passion. And when Oprah Winfrey had a special on it a couple of weeks back, I knew it was in the zeitgeist. The world was going to be talking about this. Estenda as a company is focused on digital health, software development, data analytics, and AI ML projects as well, machine learning kind of thing. So everyone's really familiar these days with the Gen AI world. But there is this whole world that has been making a difference in machine learning as well, particularly in image analysis. And we've done a lot of work in that over the years.
So I think sometimes when people get scared of AI in industries, I think they don't realize they worry about it taking people's jobs. And I know there's some doctors worried about that, but I don't think some people realize how much we really use AI without knowing we use AI. I mean, an example that I have, and please correct me if I'm wrong, and I just came to this epiphany like within the last few months, maybe years, is that one of the first AI things we ever had was a digital picture. Isn't digital picture literally AI, correct?
I wouldn't call digital pictures AI. It's obviously definitely technology and application of technology. I think the thing that differentiates it when you move into the world of AI is the ability to learn. So today on your smartphone, when you're doing image editing, that is taking advantage of the AI capabilities. When you say, hey, take out this picture or replace this thing in the background, that's using AI where they've trained systems to be able to do that. And that's a differentiator between just, I'll call it old school, technology and the new AI way of the world. But you're absolutely right in the sense that we use it every day. Like you can't avoid it. If you use Grammarly for, checking of your documents or Google Docs or Word, like it's in there.
Right.
It's AI behind the scenes. And now Apple Intelligence, I love how they rebranded AI to be their thing. It's slowly rolling out. But again, you're not going to be able to avoid it. You're going to be using it every day. But it's fascinating because it is going to make us much more efficient, more productive in the world.
Janet, what kind of questions do you have?
So in medicine, I think the biggest fear is that, the learning curve. There's a learning curve in AI. And how do we get to that point where it's beneficial, but also safe?
I think first you have to start using it, play with it. Like if you have that fear, as I've talked to various people at different industry conferences, they've started playing with it, doctors, healthcare professionals, general people, and as they start to use it, they're like, I wasn't too impressed. Well, you need to go the next step. So it's something as simple as saying, act like an expert in medicine, act like an expert in marketing, act like a nutrition expert, and then ask it your question. And that simple change in how you prompt it, which is when you interact with it, is going to make a difference in what you see as an output. The other thing in terms of writing style, a lot of people, look at it and like, well, that wasn't too impressive. But again, if you change how you interact it, ask it to write like Bill Gates, ask it to write like Bill Murray, famous comedian, you're going to get completely different responses from it, which is part of that fascinating aspect. And when it comes to medicine and healthcare in general, and doctors using it, health practitioners using it, it has significant advantages. And two of the big use cases today are ambient listening. So as you're talking with your physician as part of your primary care encounter, it's listening and taking the notes and creating the encounter notes for you instead of the physician typing away at the keyboard. Nobody wants to sit there and type away at the keyboard, but it's become necessity because of the EMR and that you have to capture this data for billing purposes. But now with the ambient listening technology, you don't have to do that. It's listening to that encounter. It's creating the note for you. And the second aspect then where it's really starting to be adopted is in summarizing the information that is in the EMR. We moved from paper charts where everything was like really hard to find, but that physician was familiar with you as a patient and would have like that one-page summary in the charts. You could open it up and look at it and be like, okay, here's what's going on. With the EMR, seeing that data and getting the overview is much more difficult. And so now if we use the AI to summarize that information and surface things that are relevant, another huge benefit in terms of productivity and time and improving care. And I'm waiting for when these two things get combined. So the computer, the AI is listening to that encounter, is aware of what other information is in the medical information that the patient may not have brought up. Like say this is your first appointment with a particular doctor and they're not intimately familiar with your history. And you as a patient forget to tell them some important factor that you're on a particular medicine. But that information is available in the medical record. The AI can surface that information to make it interesting. But, and here's where I think it really gets interesting, the AI can be aware of all of the current research that's available and bring that data together and ask questions. I think right now today, from a acceptability perspective, those questions would be surfaced to the physician, and then they can make the educated choice of, okay, am I actually going to ask the patient this question? But it's an incredible opportunity to bring these different things together and make for a better healthcare experience.
So I got to be devil's advocate, RJ. Are you ready?
I'm ready. Let's go for it.
Okay. So I will say, I love the idea. I really do. But I will say, we or physicians and prescribers and healthcare professionals were told the same thing about basically EMR or EHR. And they were told how this is going to free up your time so you can deal more with the direct patient stuff and not as much charting, yada, yada, yada. Well, what it really has done is it's made it a vehicle where physicians can chart faster so they can see more patients so they can make more money for the system. Would you agree with that? That's how EMR was sold?
That is 100% how EMRs were sold, and it 100% just didn't work out that way.
Right. So why should we think AI is going to be any different?
It is a good question. And I have heard this before, and I fear that it's going to stall adoption because AI, and we're already seeing it, where it can improve efficiency instead of having to take those notes and use that pajama time when you're home, to finish the encounter notes. Let the AI do that. You still need to review them. It's not 100%. You do need to review them. Okay, great. Now I have this much more time back. There's this fear then that the enterprise, the health system is going to be like, oh, now you're so much more efficient. You can see 10 more patients. And also the insurance industry will start questioning this like, oh, it's much easier for you to treat that patient. I don't need to pay you as much. So there are definitely fears there and definite potential things that business economics come into play that, we all have to be very cautious about. But I look at it, Gen AI specifically, as a paradigm shift. And I compare it to the printing press and writing, the invention of electricity, the assembly line, the internet, mobile phones. That's the paradigm shift that we're seeing already with the capabilities of Gen AI. And it's not perfect today, but we're already seeing that. And that's why I think that's different. It's a game-changing technology.
And what, speaking of health insurance companies, if you followed our podcast enough, you would realize that Jan and I absolutely despise health insurance. And we think it's one of the biggest scams in healthcare. Usually drug companies and health insurance companies are in collusion to basically create a cartel to rip off consumers. And I mean, I really honestly believe that's a fact. So what if they get involved in this Gen AI and they're like, diagnosis of XYZ, that means you prescribe XYZ drug that's on our formulary. I could see that happening, right?
Yeah, there are, with all new technologies, there are obviously risks. And the more we talk about them, the more we can bring awareness to them and hopefully prevent them from becoming a reality. It is, and the pace of change is also interesting because everyone starts talking about legislation and what safeguards do we put in place. But this technology is moving so fast, it's really hard to do that in time to make an impact. So some of this is on industry to make the wise decisions, the decisions that are better for the benefit of the patient and not necessarily their bottom line. But yeah, there are dangers of this as you start seeing that information, getting access to that information. But I look at it from a different perspective. There's an obesity crisis. GLP-1s are making a difference, but not everybody can go on GLP-1 drugs, and you really shouldn't be on them for your entire life. And they're not changing behavior. So when you go off of them, you're going to start eating like you did before, start gaining the weight back. And we have a mental health crisis. We don't have enough people to care for everybody that needs the care. It's just, I heard someone say a while back, it's like, we can't birth our way out of this problem. Like we're just can't have enough babies, can't train enough people to provide the care that people need. And it's not getting better, it's getting worse. And the power of technology to help people through the use of Gen AI is a huge opportunity. Again, you do have to be cautious of the risk. There was something in the media a couple of weeks ago that, unfortunately, a teenage boy committed suicide. He was interacting with a character driven by generative AI, and the young man, had mental health issues that just were unidentified by the health system. And it led to very unfortunate circumstances. And so, yes, we absolutely have to guard of that and be aware of it and surface this, which is why I mentioned it today. It's like, make people aware that this risk is out there, but it shouldn't stop us either, because that is tragic, absolutely. But at the same time, the technology can help hundreds of thousands, if not millions of people.
Janet, what kind of questions do you have?
Well, I think what our concern has been is that the art of medicine is really an art. It's not just XYZ, or it's not as easy as just saying if this, and this, because we all respond so differently. So there's we throw this story out where we interviewed a doctor, and he said, you might have a child that has a fever of 103, but he's running around and he's playing and he's, bouncing off the wall and he's okay, right? And then one comes in and it has a fever of maybe 100 or 99, but the child's lethargic. So numbers mean something, but observation is really still important. So I think there's kind of this underlying thing of how do we put this together? And I don't think you can really lose that human part of the art of, observation of how, and really that really plays, if you look into veterinarians, I mean, their patients aren't speaking to them. So they're really, right. And so we still need to have that balance, I think, between the art and then the information we're gathering.
Yes, and years ago, I remember working with a doctor, and a very senior member of the staff had been there for 30 years. He still made a point of going to the waiting room to get the patient and walk them back to the office, the exam room, such that he could do just that. He could observe the patient just walking, because he's like, I learned so much from that, 30 seconds, that, this patient's not going to talk about their, oh, it's hard for me to walk, or those types of things. So yes, the art of observation is huge. And that's, I kidded that, Apple Intelligence, like, rebranded it to Apple Intelligence. I want to rebrand it as augmented intelligence. How do we use the power of AI to help you do a better job? How do we get you out of that EMR such that you're not typing and paying attention to what's on the screen? Let you get back to the reason you practice medicine, to work with people, to help care with people. How much do you miss if your head's down, typing on a keyboard,
Yeah.
and checking that 30th checkbox that you have to do in the EMR?
Yeah.
Yeah. I think it has that type of advantage and capabilities to let humans be humans.
Well, I think ultimately, one of the things is, as we embrace technology, and AI is coming whether we want it or not. And I think with any kind of technology, whether it be, the internet 30 years ago, you either embrace it or you get left out. But you got to decide, but ultimately you got to decide how you're going to let it control you. And for those that are, healthcare professionals that are scared of AI either taking their jobs or what have you, ultimately they've got to be in control. And that's up to them to decide that. And if they are working in a system that is going to take that control away from them, then they need to stand up and say that this is not appropriate. And we've seen that happen. We've seen that happen with physicians over the last 3 decades, is that they've lost control of a lot of what they do, their autonomy. Most of them are employed physicians now instead of being independent. And really, I place the blame on them. They need to take medicine back. And the same with AI. What they need to learn. They're going to have to learn AI. I get it, but ultimately they've got to be in control of what goes on between them and the patient and what gets documented. They've got to be able to control that. And if they can't, then they need to rethink their position.
I love the thought, because it's absolutely true. You are the person that is in charge. It ultimately comes down to you as that human in that moment making those decisions. Yes, technology can empower you, but it's not making all of the decisions just yet.
Right.
It's not replacing anybody anytime soon, but it is enabling a world where we can deliver care to more people where they need it. And, because if I get sick, I go to the doctor, but, the rest of the year, I'm not seeing a doctor. They're not aware of what's going on with me. So I think just where doctors need to be more, I'll say, accountable for how the technology is used, we as individuals need to be more accountable for our healthcare.
Isn't that true?
Yeah, as a society, we're not there, but it's definitely that shift as we move from a sick care system. We have and move to a value-based world where the health systems are incentivized to keep us all healthier. That really is for us, me as an individual, you as individuals, we need to be accountable for our own healthcare, because it is so much what I eat and how I move, levels of stress, sleep, that are going to make a difference in the end.
Well, you haven't read my book yet, I don't think. Maybe you have, but being a podcast guest, you'll be able to you'll get a free copy of my book. And my book is Sickened: How the Government Ruined Healthcare and How to Fix It. And you're speaking about the number one fix is that individuals need to take charge of their own health. And our goal is to educate and empower them to do that. There is no government agency, like you're talking about, government regulations and legislation. That's the last thing we need on AI, because you're right. There's no way that government legislation can keep up with technology whatsoever. And we just don't need the government to get more involved. We need patients to ultimately take charge of their own health. And you talked about, eating, and, the best health insurance we have is not some plan that our employer buys for us. The best health insurance we have is what we put in our bodies. That's absolutely the best health insurance we have, and how we move and sleep, and that goes along with it. But, ultimately that's the best health insurance, not some kind of policy that we can buy.
Absolutely. I look forward to reading your book. Interestingly, I am very much on a journey of writing my own book about productivity. And the key to it is not time management, but energy management. And you need to get your sleep and eat better and move. It's interesting. I'm very careful of not saying exercise.
You notice I said movement too.
Yes,
I mean, people get scared of exercise.
Yeah, you did, which is why I'm calling attention to it, because yes, a lot of people are like, oh, I exercise, that's so hard. But it's not. It's move. And so one of the things that I recently did is various different, there's for diabetes, companies have a continuous glucose monitor in the market. So if you have diabetes, you can wear this sensor in your arm. It's very easy to wear. That tells you what's going on in your body with your glucose levels. Powerful, amazing technology. They have now created similar sensors for people without diabetes. And I'm fortunate that I don't have diabetes. But very fascinated to see what this could tell me about my eating habits and my, we'll call them movement patterns for now. And I know the science. Like, I've helped develop some of these algorithms over the years. But it was fascinating to see that in an app on my phone, that one day I'll eat a meal and then just sit down afterwards. The next day I ate the same meal and went for a 10-minute walk. And it made a difference in how my body reacted to that food in a better fashion. Just walking for 10 minutes after I ate. Like, I know the science, but to see that in real time is very powerful. And that's part of what when we talk about, individual accountability in healthcare, I think one of those aspects is, the wearable technology, so we can understand more of what's going on in our body, and the use of AI to interpret that information and help me better understand it. And then how do I make changes to improve my health? And it is very much movement, not necessarily exercise. Exercise is good too, but start with movement. It's that simple.
Well, I think healthcare, from our perspective, healthcare really should be prevention and then healing if we need to. We've kind of looked at it, I think, in our culture, at least in the United States, backwards, where we come in when we're sick, not when we're healthy. But, technology is helpful from the standpoint of, let's say you do have a trend and things are going well. When things aren't going well, that's showing up too. So that can be also, my husband has a coach, and when things aren't going well, maybe physically, his coach will say, okay, we're going to do this or this or this, right? But that's all based on not just how he's feeling and talking, but his performance and all that data that's put into his program that he has to communicate with his coach, right? So we could certainly use this information, because your doctor could see over time, how all these things are playing out in your life, and then interpret something with you in front of them. So we could use it as individuals to help our own outcomes by keeping data as well. And I'm imagining there's, with all these things that are out, like we have like Fitness Pal, different programs for food or whatever, that that data could be really important for us.
Absolutely. And this is one of those, as we help other companies develop their products that they're taking to market, particularly, we help work with, large Fortune 50 companies, but also startups, because I'm just always fascinated by taking on that next challenge and how can we make a difference. But we have talked to a lot of startups, And they're like, we have this data. We're going to find the patterns. We're going to show them to the doctor.
Mm-hmm.
And then they pause and stop. And I'm like, and, so as people develop these new tools and technologies, you do have to go beyond just pattern recognition and sharing the data. And how can you go the next step of a recommendation or help that physician better understand that data? I just bought this headband that looks at my brain waves and like alpha and delta and theta waves and kind of thing. And I'm trying to figure out what the heck all this stuff means. And if I take this to my doctor,
yeah, right.
He's gonna laugh at me.
right.
Right. Well, I'd probably be laughing too. I'd be like,
Yeah. And I have a great doctor, and he would laugh at me, and I would laugh back, because it's like, yeah, you don't know what to do with this.
Well,
so yeah, how do you go that next level?
Yeah, and if you're not going to do anything with the data, why collect the data? Is one thing, and I think you need to start collecting the data and learn patterns and stuff before you can really do something with it. But there's certain things like an Aura ring, is a good example. It's you're probably familiar. It monitors your sleep patterns and all that kind of stuff, your heart rate and all that kind of stuff. And some people ask me why I don't wear one. It's like, well, because it is not going to show me anything that's going to change my habits at all. I know what I need for sleep. I already know those things. It's kind of like a CGM. I've worn a continuous glucose monitor. I'm not a diabetic, but I wanted to see what it would do mostly during my long training rides and races, bike races. Very interesting data, not really surprising, actually. But I think what scares me about like continuous glucose monitors and AI and insulin pumps, let's say, it makes it really easy for a patient to wash their hands of their own responsibility of what they're eating. I don't have to worry about what I'm eating. My continuous glucose monitor is taking care of it, and my pump will give me more insulin. That's a problem with AI. And I can it's already kind of happening. There's already beta programs and maybe it's beyond that right now. But I know it's already happening, and that to me concerns me. That's why I'm not a really big fan of continuous glucose monitors, because if you know how to eat and what your blood sugar does already, you shouldn't have to monitor your glucose continuously.
Yeah, I agree and I disagree. So I definitely agree with the idea that it does take away some of that accountability, and you can just let the device, because there are FDA approved closed loop systems that'll just manage your glucose for you. And so, yeah, you can, make the choice of saying, okay, I'm not going to worry about it. I can eat whatever I want. That is not a best strategy in life, let alone if you have, a chronic condition. But I think, particularly with diabetes, the awareness of exactly what's happening in your body and exactly what's happening when you eat a particular meal, your stress levels, there's so many variables that come into play. Like, even if you eat an apple every day kind of thing, there may be one day, because you didn't get a lot of sleep the night before, because you're higher stress, you have an exam or a big corporate presentation coming up, your body's going to interact differently to that same meal. And only if you're monitoring are you going to know that. And you really do want to. So that's sort of where I hedge my bets in that, and agree and disagree at the same time.
I guess my point is, though, RJ, is if you monitor enough, you'll realize those things. I know what happens with my body when I don't get sleep. I know what happens with my blood glucose when I crash my bike.
Yeah. And perhaps it's that learning exercise.
Exactly.
You use that to learn, but not use it continually. I could probably get behind that. Because I understand, I wear the Aura ring. I've worn numerous devices over the years. I used to wear like a heart rate monitor with multiple wires going all over underneath my shirt to this is fascinating technology to see what my heart rate is. It's so much easier to track these days. But it is, you reference bikes, I race triathlons. So, I'm very in tune to what my body does. And it's always interesting because I wake up and look at my numbers and it tells me my readiness score. And I'm like, well, yeah, I'm not ready. I did a really hard leg workout tomorrow, and you're just not detecting that. I'm not doing
Right.
anything today.
Right.
Like, I know that because I've been doing this for 20 years now.
Exactly. Well, I think that's what's our job, whether you be in software development or us in healthcare, is for us to leverage these technologies to teach patients
Mhm.
on, what they should, what is appropriate, instead of making them lazy, making them more in tune with their bodies, and knowing, how to leverage this technology.
There's powerful, powerful capabilities. I think the other thing too that I really like is sort of Gen AI capabilities that will help make a difference in this, in that learning. We'll call it the learning process to, understand how you interact with your environment. It can speak to your literacy level, your numeracy level, your health literacy level. So God forbid you get diagnosed with cancer, you're going to have all sorts of questions. You have a conversation with a doctor, you're going to leave that office and probably forget 50%, 90% of what he's talking about.
100%. Yep.
But if you can use the AI technology and it can explain stuff and it'd be like, oh, I didn't understand that. Can you make it more simple for me? Okay, I still don't get it. Can you make it more simple for me? So, go to ChatGPT or Claude or whatever you use and ask it to explain quantum physics to you. And be like, explain it as a kindergartner, and it will do just that. It will create the analogies to help you understand that, which is a powerful thing to, help meet people where they are.
Yeah, for sure. So, as we wind this podcast up, RJ, tell us what you have a passion for.
Beyond triathlon, because that's always, the sort of leading thing, but it's a passion for helping others. That's what got me into healthcare. That's why I started Estenda. It's baked into our processes within the company, kind of thing. When we do our performance reviews and stuff like that, it's always like, how have you helped others? We really teach the idea of empathy, like understanding, the situation that patient's going through, or how the doctor cares for them. Understanding and how to make a difference and help people. That's what I'm ultimately passionate about. The idea of my book of productivity is just, it's taking a step back and not doing those 50,000 things and guarding your physical health and your mental well-being. It's helping people. That's what I'm passionate about.
I love it. So we're streaming your website here. Tell us a little bit about the website and your company.
Yeah, Estenda has been going for 20 years now, which has just been a fascinating journey. Professional services. So we don't sell a product. We help you create your product. You own it. You market it. We can help you in all of those aspects. We very much focus on what I think of as the innovative patient care and wellness side of things. So as you have data, developing new algorithms that a physician's going to use or a nurse is going to use in patient care, or the patient uses directly. Typically things that have to go into a clinical trial. I have some PhDs on staff that can help drive, that conversation, the science behind it, write the journal articles. But yeah, it's all about helping people, which is what's made this fascinating. A lot of our work is grant-based, so we'll partner with an institution and write a grant together to go off and create something truly innovative.
I love it. Well, thank you for being on today, RJ. You've helped us realize our goal, which is to educate and empower individuals to take charge of their own health, and AI can definitely help that. So thank you so much for being on today.
Thank you. Glad to be here and happy I could help.
And hang on to the podcast after we finish up. I'd like to chat with you for a few minutes. And listeners and viewers, thank you for tuning into Health Solutions with Sean and Janet Needham. Tune in Monday to our regularly scheduled podcast, 12:30 to 1:30 Pacific Standard Time. Thank you.